Hafa and good morning, and also Hafa and good evening to our federal partners joining us from the East Coast. Apologies for the delay. We did have a little bit of a slip with daylight savings. It's also been a very crazy week. So thank you for joining us, for taking the time. My name is Crystal Paco San Augustine from the Office of the Governor of Guam, and we are delighted to host this event, this conversation with U.S. Surgeon General Dr. Jerome Adams on COVID-19. This is a partnership with our three branches of government, and we are so honored to have our federal partners online, as I mentioned. At this time, I would like to acknowledge the presence of our local leadership. Of course, we have our Magahaga, Governor Lou Leon Guerrero, as well as our Lieutenant Governor Joshua F. Tenorio. From the 35th Guam Legislature, we have Speaker Tina Rose Munya-Barnes. Representing the Judiciary of Guam, we have Administrator of the Courts, Ms. Christina Baird. Local leadership would not be complete without our island mayors. We do have Mayor's Council of Guam President and Mayor of one of our biggest villages here on the island, Deputy Mayor Melissa Savares. And we also have leading our public health emergency, our response efforts, we have Public Health Director Arthur San Augustine. And of course, we have our honored guest today with us. We have U.S. Surgeon General Dr. Jerome Adams, and you can probably see his team on the screen. Thank you all for taking the time. In the best interest of time, here's a quick outline of events. We will have brief remarks from our local leadership to be followed immediately after by remarks from Dr. Adams. Media will have an opportunity to text in their questions. He will answer these questions. He and his team will answer these questions. They've all graciously agreed to take these questions and answer them in the time allotted. We will then close out with remarks from our Lieutenant Governor. So without further ado, I want to give the floor to our Honorable Magahaga, Governor Lou Leon Guerrero, for her remarks.
Thank you very much, Crystal, and to the Surgeon General, Dr. Jerome Adams. Welcome to Virtual Guam. It's unfortunate you're not here in person, face to face, so you could really get the full flavor of our culture and our beautiful island. But we welcome you anytime. And of course, your federal partners also. John is a Chamorro now. He's been here many, many times. So we're gonna have to find a Chamorro name for you, John. And then, of course, all the others that are visiting and also our federal partners, Lieutenant Governor Hafa, Speaker, Madam Speaker Tina Munya-Barnes, and of course, our President of our Mayor's Council, Mayor Savares, and all the federal partners and our local partners. I just wanted to greet you and say welcome to this virtual meeting. And wanted to just make some few remarks. And one of course, again, reiterate that it's been 8 months now that we've been battling the largest public health crisis in the world, unprecedented. Thousands of our people have been infected by COVID-19, and now 85 of our neighbors were lost in battle. Guam Memorial Hospital, our only public hospital, has seen more COVID-19 patients than it ever has before, and it seems that we reach a new peak of hospitalization each week. Our sole mission was to save as many lives as possible and to prevent a time when the number of people infected grew so large so quickly. We no longer had enough doctors, nurses, ventilators, or even beds to treat them. This virus does not care about our age, it does not care about race, nor does it care about gender. And it has brought even the strongest among us to their knees. For 8 months, we have been battling the largest crisis in the world, and that is why we've been engaged in the largest public health response in our history. I know it's hard to feel like we have made any progress at all, but in April, just 7 months ago, the Federal Emergency Management Agency predicted that Guam could see as many as 26,000 cases. Our actual number is 4,500. FEMA's same model predicted that COVID hospitalization would peak at 3,000 in June. Our actual number in October is less than 100. Yes, our quarantine protocols, our testing, our contact tracing, and isolation helped us from making that nightmare into our reality. But we were able to prevent it, and it is because of our community's effort and vigilance. Today, Vice Admiral Jerome Adams, the Surgeon General of the United States, is here with us to discuss the trends and data that have been observed across the United States. He will tell you that what we are experiencing in Guam is no different than what has happened and is happening throughout the United States. And he will tell you that to win against COVID 19, our frontliners must be in the community, not in the clinics and not in the hospitals. I know many of us are tired and we long for our lives before COVID 19, but that mindset will be our downfall. Surviving with this virus does not mean going back to business as usual. It means adopting best practices to protect ourselves and our community for the foreseeable future. This is difficult and it will be a test unlike any we have seen before. But I know our people and I know that we will get through this. Thank you and Sidzus Masi.
Thank you, Governor. I now like to give the floor to Speaker Tina Roseminia Barnes.
Sijulis Masi, Crystal, can you hear me? Papadej and Manana Sijulis, Governor, Lieutenant Governor Christina Bird from the Unified Courts, and Mayor Melissa Savares, Manana Sijulis. I want to thank all of you for allowing us here today. I also see GMH and Public Health and Social Services, your team is here. I also see Adjutant General Esther Agigi. Thank you for joining us, but more importantly, thank you all. Even I think I saw the Guam Fire Department here, and I just want to say thank you for your continued efforts to keep our island safe. Dr. Jerome Adams, Hafaday, to you and to your team. And I want to especially do a shout out to Director Heidig because I want to say, Sijulis Maasi, thank you for your continued support for Guam as we all combat this COVID-19 together. I just want to say the early morning and late night phone calls we have had and the immediate responses to my emails. I want to say it truly demonstrates your commitment to our people of Guam. So Sijulis Maasi again for keeping up with me. I also just want to share that just this morning I got word again that another relative had passed due to this COVID. And yesterday, here at the legislature, we mourned the loss of one of our own employees, family member. And I want to say that during times like this, it's really hard on many of our island families. And we definitely need to continue to step up for the sake of our island. In a small, tight-knit family here, while our numbers of fatalities may be much smaller than that of other jurisdictions, when you compare them to it per capita, you can see that our ratio here on Guam is much higher. And Dr. Jerome Adams from the weekly briefings calls with the Office of Intergovernmental Affairs, you have definitely provided me a greater insight to 19 as a policymaker, and I am grateful that today our entire island can see and hear from you on how we can all come together to combat this invisible war together. And I just want to extend my Saina Maasi to all the staff from both the legislature's office, the governor's office, the administration, and all the stakeholders here to put together this meeting. And I want to say that our continued collaboration with everybody and our island community, we have to do this together, and we have to combat this horrible disease, and only together then we can overcome it. And I just want to say that you being here this morning really shows that true spirit of Inafamalik, meaning to make better, to come together and do what's right by all our people. So God bless you, and thank you for keeping Guam close and near to your heart. Sinamasi.
Jesus Masi, Speaker. Again, like I mentioned, our island is heavily, our island mayors are heavily involved in our leadership here. They're crucial to our public health response. I'd like to introduce MCOG President Melissa Savares, Dededo Mayor. Mayor, if you can unmute.
Hi, good morning. Thank you, Crystal, for the opportunity. Thank you, Governor. Welcome to Guam virtually, Surgeon General Jerome Adams. It's a pleasure for me to be here to represent our mayors throughout the island. We have 19 different municipalities, villages that are led by village mayors. And we are boots on the ground. We have direct contact with residents. We work very closely with our partners in government. The Department of Public Health has been our partner since the beginning of COVID. We're with them every day, holding hands, going out into our streets and talking to our people. And of course, with the rise in numbers of positive COVID patients in our communities and seeing how families continue to gather, we work close. We are right there talking to families and continuing to work to make our neighborhoods safer, and sharing the information and the importance of social distancing, wearing their mask, washing hands, keeping each other safe. And of course, you know, with the holidays coming up, it's families want to embrace each other. But of course, with the executive order and the high numbers of hospitalization that we have, and up to 83 deaths today, you know, we're very, very careful and continuing to share the importance of being safe as a family. Speaker mentioned, and the governor mentioned, how we have lost some families to the battle of COVID. However, you know, trying to reintroduce the ways of connecting and comforting each other via Zoom or internet or Facebook is how families are comforting each other. And you know, here on Guam, we're islands and our cultures are very familiar oriented. We're so used to being with each other, and our most vulnerable communities are our senior citizens, as we've seen, and we continue to make sure that our seniors that live alone get their meals on a daily basis, and we continue to check them and partner with other entities and organizations to support each other in the community. So thank you for the opportunity. We're excited to hear more information on what we can do and as a partner to keep our communities safe. Thank you and God bless.
Jesus Masi, Mayor. Now I'd like to give the floor to our Public Health Director, Arthur St. Augustine.
Thank you so much, Crystal. Governor Lilian Guerrero, Lieutenant Governor Josh Tenorio, Speaker Barnes. I would like to, first and foremost, on behalf of our island community, we'd like to extend a warm buenos and hafa welcome to our U.S. Surgeon General, Dr. Jerome Adams. We appreciate your time with us to have a conversation on COVID-19. We are looking forward to your message and perhaps a sharing of best practices, models, and approaches you have seen that have been effective in the response, the fight against COVID-19. For Guam, our declaration of the public health emergency started in March and continues on. As of this morning's situation report, we have 4,903 positives of the 65,059 tested, or approximately 44% of our community has been tested. Using the 65,059 as a reference, 4,903 or 7% have resulted in positive cases. Our positive case count in March was 77, and it took a slight dip in April to 71, but took an even bigger dip to 25 in May. Then in June, the positive case count increased to 92 and 95 in July. However, in August, the positive case count exponentially increased to 1,085, approximately 1,000% increase, and increasing further in September to 1,108, and literally doubling in October to 2,209. The past 3 months, August, September, and October totaled 4,402 positive cases, or 90% of the total positive cases of 4,903. The last 3 months has been our most challenging period. We have seen surges at our hospitals, both at one government and one civilian hospitals. We have created a rapid engagement team to respond to identify clusters that proved effective, identifying 117 positive cases in a span of 3 days, and more importantly, providing intervention to contain and control the spread of the virus. And we have seen continued increase in requests for testing and attributing the loss of family and friends to the virus. In our continued response, public health and its many partners, both traditional and non-traditional partners, are working together in response to the virus. There are many varying opinions and approaches. What is best said of the many people working on the response is the dedication, commitment, and honor to serve our community in its greatest time of need. This enemy, invisible to the naked eye and non-discriminatory, has called on the community to stand together in response to the virus. Today, COVID-19 has brought various disciplines to the forefront to respond to the impact on the health, social and mental health, and economic fronts the virus has devastated. Our healthcare system is challenged. Our social and mental well-being is challenged, and our economic security is challenged. Our response has seen the development of working groups that perhaps did not work together in prior response efforts. More recently, many members of the response team, including Governor Lulian Guerrero and Lieutenant Governor Joshua Tenorio, were an audience before a multi-vested group who presented a pilot project to prepare for the reopening of Guam. The group is comprised of the University of Guam, Guam Hotel and Restaurant Association, Guam Visitors Bureau, Guam Community College, and the American Medical Center, with Public Health and Social Services being invited to be its newest planning member. As the discussion of reopening Guam is critical, what is notable is the recognition of the new normal. The reopening plans has contact tracing, partnering with a CLIA certified clinic for rapid tests of employees, and public health having a seat in the business plan. These are all in response to the public health crisis today. The acceptance of our new normal in doing business, the ability to respond timely, scale operations back, or to increase operations, and to be responsible for the testing of staff as part of its routine operations. As in many places, in response to COVID-19, operationally, we have implemented the incident command system, community target, drive-through, and homebound testing, call center, quarantine and isolation facilities, education campaigns for wearing masks, proper hand washing etiquette, and social distancing, messaging through the Joint Information Center, and established arrival protocols for inbound travelers. U.S. Surgeon General, Dr. Adams. Today, This morning is our opportunity to have a conversation with you and you with us. Therefore, I will close with again welcoming you as the governor, lieutenant governor, the speaker, and the president and mayor of Dededo, President Tavares, to welcome you virtually to Guam. And like the rest of us here today, are anxious to hear from you what the future holds from your perspective as U.S. Surgeon General. And we wish you the best in the work you do for all of us. And as I also like to close, I do want to share with you, Dr. Adams, that many of your partners out here, Dr. Hancock, Commander Matthew Johns, who we've done visual calls, Zoom calls, and others, Captain Bearden. Recently, we also met with John Bartlett, again, a second time. Have all been very supportive to public health and social services in our response. And the many other partners that I see here that I've communicated with from various entities of the federal government in response and in assistance to us. So I thank them for their help, but I also wanted to share that with you. So thank you. And virtually again, as many of us here in Guam say, I've been saying to you, welcome virtually to Guam, and we'd like to hear from you this morning. Thank you so much for taking time to be with us. Sizos Maasi.
Thank you, Director San Augustine. I'd also be remiss if I didn't acknowledge the presence of our surgeon cell. We have Dr. Mike Cruz also joining us today. And without further ado, I'd like to introduce our honored guests today. Joining us from DC, we have Vice Admiral Jerome Adams. He is the 20th Surgeon General of the United States. His mission as the nation's doctor is to advance the health of the American people. And his motto is better health through better partnerships. He is committed to forging new partnerships and strengthening existing relationships with members from the business, faith, education, and public safety and national security communities. So without further ado, I'd like to introduce Dr. Adams.
Well, Afade, and thank you, Governor Guerrero, for your strong leadership during the pandemic. To all the other dignitaries who were on both federal and local, I just want to give you a real dose of vitamin G gratitude from the Surgeon General of the United States. I am honored to virtually connect with you all today to provide updates regarding COVID-19 in Guam and how together I feel we can safely and swiftly get through this challenging time. And I don't want to get off the rails too early, but I said safely and swiftly. And I want you all to know this disease, it runs a course of about 2 weeks. And we've seen in New York, we've seen in Arizona, we've seen in places around the country and around the world that if we take the right measures now, then in about 4 to 6 weeks, we can get this virus under control, because 2 weeks is from exposure is about the time frame it takes for the last people who are going to get symptoms to get symptoms. And then those people go in the hospital, and it's about 2 weeks after that, then unfortunately you see people passing from this virus. But the fact is, 4 to 6 weeks, we can get this virus under control if we all make a commitment today to doing the right things. So I want to thank the healthcare professionals and essential workers who are participating today for the work you've done on behalf of your communities. You've truly been on the front lines of the pandemic day in and day out. And your contributions have saved lives and helped families and coworkers. And I am extremely grateful for your efforts. And to all Guamanians, I want to personally thank you for your efforts to combat the spread. SARS-CoV-2, which is the virus which causes COVID-19, has shaken the world to its core. And we've struggled over the past 10, 11 months to protect human life from a novel and deadly adversary. Indeed, we know COVID-19 and its sequelae have caused a level of strife and suffering unseen in our country for over a century, dating back to the 1918 flu pandemic. Despite valiant and timely action early on in the pandemic by your leadership and citizenry, Guam is clearly in the COVID-19 crosshairs now. And let me say right now to all of you with confidence that just as your forceful and collective action fought back this virus before, I am certain that you can regain control of this virus once again. We talked about you all on the mainland as really the exemplars for how to control this virus. You all were who we bragged about on the coronavirus task force. And I know that you can do this yet again, You just need to have the confidence and the will to do it. A strong community is a tremendous asset. I experienced this growing up in rural Southern Maryland, and again as a state health commissioner in Indiana, where we have large rural populations. I now express the power of close and personal connections in my own motto, better health through better partnerships, because it's what I lived growing up. And I want to discuss with you how the strength of your relationships, your bonds with your family, friends, businesses, and traditions can see you through this crisis. But let's start with the state of the pandemic in Guam. As you know, the number of people with COVID-19 in Guam is high and it's rising, just as in other parts of the United States and in Europe. So we're feeling the pain on the mainland too. The test positivity rate in Guam overall, which is an overall indicator of community spread, that's why we talk about test positivity, is almost 7%. And the rolling 7-day average ending October 28th is very high at 12%. We usually think once you get over 10%, you're really starting to be in trouble. We know that a rise in cases is typically followed again in 2 to 3 weeks by increased hospitalizations. A great concern because hospitals in Guam are nearing their capacity. And I don't need to tell you, unlike here in Washington, D.C., where if hospital A is full, we can put you in an ambulance and send you a mile or two down the street. You can't do that in Guam. You can't put people in an ambulance and send them to another hospital. Treatment of severe COVID-19 cases, I want you to know, has improved dramatically over the last 9 to 10 months. And it's not unusual to see rising death rates approximately 2 weeks after hospitalizations rise. But your chance of dying is much lower now than what it was in March and in April. We had about a 30% mortality rate if you got COVID-19 in March and in April versus about an 8% mortality rate now. Still too high, but again, improved. But we can't afford to put anyone in that situation, especially with limited capacity. These are the current facts. But as we know, numbers don't tell the full story. This pandemic has been challenging for every single one of us, whether you've gotten COVID, whether a loved one of yours has gotten COVID and been hospitalized or not. None of us has been unaffected. This virus has impacted our mental health, our physical health, our businesses, and our livelihoods. The last statistic I heard was that 30% of the island was currently unemployed because of the virus. And many of us, many of you, are experiencing pandemic fatigue. It's a real thing. That feeling of exhaustion with the masks, with the isolation, the loss of our traditional celebrations and comforts. It's seeping in, and it can influence all our behaviors and choices. Here's the thing, that fatigue also increases our chances of contracting and spreading the virus, which prolongs our pain and increases the length of time that we need to shut down, the length of time that we will be from getting back to normal. So despite the sadness, the frustration, and the impatience that we all feel, we all must remember that this is the time to focus on what works, to commit to each other's health and well-being, and to find compassion for each other and ourselves as we mitigate the effects of this invisible adversary. The good news, because I don't want you to think I'm just here with all bad news. The good news is you've done it before, and we know what works, starting with what I call the 3 W's. Wear a mask, watch your distance, meaning avoid indoor spaces, crowded places, and maintain 6 feet between you and others. And the 3rd W, wash your hands frequently and thoroughly. Especially as we near the holiday season, we have to take special precautions to limit exposure. Gatherings should be small and ideally held outdoors with proper distancing and mask wearing, even amongst people who you know. And let's face it, on Guam, is there anyone you don't know? So we can't just simply say, hey, I know them, they're fine. As you hopefully have heard, one of the challenges with this virus, a virus which Tony Fauci says is the most challenging he's dealt with in his 50 plus years of being a virologist. More challenging than HIV, more challenging than Ebola, more challenging than Zika. Many people with COVID-19 who are infected do not have symptoms. If you and I had a cold, one of us had a cold, you could likely look at me and know it. I'd have a runny nose, I'd have watery eyes, I'd be coughing, I'd be sneezing. But we know that 30 to 50% of people with COVID-19 do not have symptoms. You can't tell by looking at them whether they have the virus. And that means the virus can spread without their knowledge and without your knowledge. So keeping a safe distance and using masks and frequent hand washing, this will help protect friends and family, especially our elders who were most at risk. None of us wants to be the reason that anyone, but much less our elders, end up in the hospital. While these past 9 months have been a struggle for us, we also know that clinicians and public health workers, people of color, indigenous persons, people with underlying conditions, and those who are older have borne a disproportionate burden during this pandemic. This virus has highlighted a multitude of factors rooted in both pre-existing social conditions and pre-existing medical conditions that conspire to reduce our resilience, our opportunity, and our health. Here's the thing. When we think of health in general, and specifically when we think of this pandemic, most of us think of doctors, nurses, hospitals, and healthcare. And as critical as healthcare is downstream, we know that health actually begins at home and within our communities. In a vicious cycle, social determinants in our communities, things like access to transportation, childcare, and safe, affordable housing, they contribute to medical determinants, chronic diseases such as diabetes, lung disease, and high blood pressure. And quite frankly, it shouldn't be a surprise that many of these chronic diseases are especially common in communities of color and again, in indigenous persons. So the social determinants, they make individuals more susceptible to infection with COVID-19, while the medical determinants are associated with more severe COVID complications and many more deaths. As an example, people of color are more likely to live in densely packed urban areas and in multi-generational homes. They're more likely to use public transportation. And we know that social distancing and teleworking are critical to preventing spread of the virus. Yet, only 1 in 5 African Americans and 1 in 6 Hispanic Americans have a job that allows them to work from home. We know many Guamanians don't have jobs that allow them to telework. We know that these factors collectively create greater risk for spread of a highly contagious disease like COVID-19 and make it much harder for people to isolate or quarantine if they have been diagnosed with or exposed to the virus. And as a consequence, here on the mainland, we've seen American Indians, Alaska Natives, and African Americans hospitalized at 5 times higher rates than whites. Hospitalization rates are 4.5 times higher for Hispanics compared to whites. And we know that Chamorros and especially, I believe it's called the Chukus, have been especially hard hit there in Guam. An underlying theme throughout all of my work is underlying and addressing the reasons for these existing disparities and finding effective methods to advance health equity. And this has only been fortified by the pandemic's revelations. Within the US government, we've acknowledged and are working to prevent these disparate and terrible outcomes, but there's much more that needs to be done. Tragically, there have been more than 2,300 fatalities due to COVID-19 across the US, and we're approaching 9.3 million Americans diagnosed. In Guam, the data suggests the Chuukese and the Micronesian populations, again, have been hardest hit. But even the president and first lady were infected, which just goes to show us that everyone is vulnerable, regardless of geographic location or privilege. Even the White House is not immune to this virus. The Surgeon General of the United States, I speak to you now, and I have 2 relatives who've been diagnosed with COVID-19 and a third that is in the hospital. The impact of this pandemic, it also goes well beyond physical illness. As the nation's doctor, I've always stressed that physical health and mental health are equally important, and they're inextricably intertwined. This pandemic has revealed the psychological threat of physical distancing, which again is a tactic we strongly recommend to slow the spread of the virus. Physical separation is effective to reduce the risk of infection, but we know that it can potentially lead to social isolation and that mental health can suffer. That's why I encourage you to continue to use healthy mechanisms to cope with stress and anxiety, such as practicing the tried and true habits that will keep us safe and healthy in mind, body, and spirit. Make sure you're getting enough sleep. Make sure you're getting outside, staying active in a safe manner, and that you're trying to eat a healthy diet. Be proactive and reach out to friends and family over a phone, FaceTime. Try virtual therapy if you need someone to talk to. There are many ways that we have now with these things to maintain social connectedness, even as we try to practice physical distancing. I know that this is a very stressful time. And I need not remind you of this, but it's worth saying that the people of Guam have experienced great stresses. I'd actually say greater stresses before. You've faced devastation time and again from typhoons, and time and again, you've rebuilt and restored your communities. You've really prided yourselves on your participation in the last World War that we had in this country. And again, that did not prevent you from coming together and being strong and showing resiliency. Your tenacity, your spirit, your resilience, and your resolve. That's what's going to get you through this pandemic. And even though we have fatigue right now, understand that many of you and many of your elders have been through much worse, and they've come out the other side of it stronger because they stuck together. Well, like you, I spend most of my days and nights on COVID-19. I want you to know my office is continuing its longstanding work on other critical issues that have added urgency and relevance now, in part because of the light they shine on the impact of the social determinants of health that I talked about. For instance, COVID has shown us in an inescapable way that the health of a community and the economy are interlinked, and that good health is essential to a thriving economy and productivity. I've tweeted out many times, reject that false comparison between you're either for health or you're for reopening. The fact is, the way that we get to reopening, as your governor has said time and again, is to suppress this virus. And I want you to know that I'll release later this year, a Surgeon General's report on community health and economic prosperity, or CHEP for short, that's designed to mobilize businesses to invest deeply and consistently in the health of their communities, for the simple fact that doing so will not only improve individuals' health, but it also improves the business's bottom line. And again, nothing has made that case quite like COVID-19. I also recently released a hypertension or high blood pressure call to action, highlighting that half of adults have high blood pressure. Most people don't have it under control, and it takes twice as many lives every single year as COVID-19 will this year. Stroke, kidney disease, uncontrolled high blood pressure, heart attacks. Those will kill more people on Guam this year by far than COVID-19. And guess what? If you have uncontrolled high blood pressure, it will also put you at higher risk for these diseases, which puts you at higher risk for complications from COVID-19. So I ask that you go to surgeongeneral.gov to learn about my CHEP report and the hypertension call to action, as well as other initiatives from my office. Now, as I wrap it up, I want to take just a little bit of time to talk about how critically important it is that everyone get a flu vaccine this year. By getting our vaccinations, we protect ourselves and others from contracting the flu, measles, and other communicable diseases. And unfortunately, we've seen childhood immunizations drop dramatically during the pandemic. This puts individuals and the larger population at greater risk. It would be a shame if you lived through COVID, but ended up dying or having someone around you die or end up hospitalized from a vaccine preventable disease. Getting vaccinated and talking to others about the importance and safety of vaccines is a step we can all take to make sure we keep hospitalizations low and beds available for individuals with COVID-19 and other severe conditions. We're likely to have one or more vaccines for COVID proven safe and effective before the end of this year, with doses ready for distribution first to those most at risk. Over the ensuing months, our aim is to vaccinate millions of Americans, extending protection from COVID-19 across the continent and the Pacific. And we'll need your help to seek out and address any concerns among Guamanians and other folks on the islands about vaccine safety and efficacy to ensure equitable and easy access when the time comes. It'd be a real shame it'd be quite frankly a tragedy if we had a cure for this virus, a safe and effective vaccine, but we weren't able to stomp it out on Guam because we weren't able to get people to accept this vaccine. These are unprecedented times, and we've all been deeply affected. But despite these challenges and frustrations, I believe we can use our unfortunate losses and lessons learned as a once-in-a-lifetime opportunity to come together and address some significant and outdated aspects of our health systems, as well as to make our nations and communities healthier and more resilient in the long run. I know you're tired. I know you're tired. But whether it's Mother Nature and natural disasters or surviving and rebuilding after World War II, the people of Guam, you're fighters, you're survivors, and one of your greatest strengths is how much you deeply care about and look out for one another. So I'm asking you to look out for one another and hang in there with these public health measures just a little bit longer, because we are almost to the finish line. Once we get to the distribution of a vaccine, which will again hopefully be by the end of this year, we can start to get back to normal. We now have much greater availability of testing, including 15-minute turnaround Binax tests. So you'll be able to reopen for tourism again once you get your virus under control. But I want to remind you that many of the Asian countries who visit Guam, even without a vaccine, are open for business right now. And it's not because they ignored public health measures and pushed to reopen. It's precisely because they all followed these public health measures closely and drove down disease transmission. You've done this before, Guam, and you can do it again. And if you all get really serious and make some sacrifices now, we know that by Christmas, you can have the virus at low enough rates to feel more comfortable celebrating the holidays. So thank you. Sidu Masi, for the opportunity to speak with all of you today. And I'm really happy now to take a few questions. And I hope that once we get this virus under control, you all will invite me out there to Guam so that I can see the beauty of your island and the beauty of your people in person.
Jesus Masi, Dr. Adams. That was a great.
I apologize. I know I didn't say it exactly correctly, but I'm trying. And I think that's important. I want you all to know how much I really appreciate the hard work you're doing and how much I want to be accepted into your family. So let's work together to make it happen.
Most definitely. And thank you so much for being gracious enough to take some questions from the members of our media who have submitted some questions. Your first question: almost all of Guam's COVID-19 fatalities involved comorbidities. What assistance can the federal government provide to address our fundamental health problems, such as diabetes, heart disease, and obesity, that could have prevented most of the deaths?
Love that question. And it's exactly why I mentioned some of the calls to action that I've put out this year. I want to tell you, as Surgeon General, we are focused on controlling high blood pressure because that will stop heart disease, stroke, kidney disease, which are your top killers, but it will also save lives from COVID-19. We're trying to get people to understand that these medical conditions, which we often focus on, are important, but they're not the real problem or predictor. The real problem or predictor are upstream factors. Again, lack of access to transportation, lack of a job that pays a living wage, lack of safe and affordable housing. You're not going to be compliant with your diabetes medications if you don't know where you're going to lay your head at night. We need to address these social determinants, get upstream, and really get some of these chronic diseases under control. But otherwise, they will continue to be not only our top causes of death, but to put us at risk for diseases like COVID-19. So go to surgeongeneral.gov. You'll see some of the recommendations that I put out in my call to action that businesses can take, that faith communities can take, that nonprofits can take. This all can't be on just the doctors and the nurses. It all can't be on the federal government. We've all got to do our part. And one of the simple things you can do is know your blood pressure and recognize whether you're one of the 2 adults in America who has high blood pressure, and then take measures to help get it under control. That's one concrete thing you can do to really increase our resilience moving forward.
Thank you, Dr. Adams. Next question. Some have questioned whether lockdowns are effective in containing the spread of the virus. What is your view on that? Will Guam be on the list of US communities that will be provided with the eventual vaccine?
So 2 questions, and Guam, I'll go with the last one first. Guam will absolutely be on the list of communities that is going to be getting a vaccine once we have one proven safe and effective. And again, I expect that to happen before the end of this year. We worked with the National Academies of Science, Engineering, and Medicine, as well as with the health officials on your own island to figure out what the burden of disease was and to figure out who should get the vaccine first. And we have identified that the elderly and people with chronic medical conditions, followed by healthcare workers, should be the first in line to get the vaccine. And again, unfortunately, Guam has more than its share of the vulnerable population. So you will be getting the vaccine. One good thing is with just over 150,000 people on the island, we can get to herd immunity through a vaccine on an island like Guam a lot quicker than you can on the mainland. So that's good news. Once we get a vaccine, we should be able to go out, get people vaccinated, and really put a stop to this disease between vaccination and testing. So I say that because I want you to know we are almost to the finish line. We just got to hang in there. Now, as far as lockdowns go, we don't want to lock down. The task force has not really been advocating for lockdown since March or April, but I want you to understand this virus spreads person to person. And so sometimes if we aren't taking those basic public health measures, wearing a mask, washing your hands, and watching your distance as much as we should, recognizing that even people we know can spread this virus asymptomatically, then you force health officials' hands, you force your governor's hands, and you have to lock down because your governor, your health commissioner, they don't want to see the hospitals overwhelmed and see people with heart attacks and strokes not be able to get a bed because the beds are full with COVID-19 patients. So please understand that the way that we avoid lockdowns or shorten lockdowns is by following these basic public health measures. And we can, in 2 to 6 weeks, get this virus under control. And I know that that sounds like I'm being Pollyanna-ish, but that is the biology of the disease. If we do the right things now, and we do it hardcore for 2 to 3 weeks, we'll start to see cases trend down. And then again, it'll take a little while for those hospitalizations to filter out because the person who's exposed today will be the person with the virus 2 weeks from now, and they'll be the person in the hospital 3 to 4 weeks from now. So understand that, but understand if you take the measures today, we can get this virus under control in a few weeks, and then we can get to a place where your governor and your other health officials and your other politicians can safely reopen. That's what we want to do. We don't want to just reopen and cause people to die. We want to safely reopen, and we can do it if we all work together.
Thank you, Dr. Adams. Next question. While battling COVID, countries and United States, notably Hawaii, have already opened with some success for tourism, business, and resident travel. Please comment on a two-pronged approach with pre-testing that will allow some economic progress.
Well, I mentioned this earlier. We now have Binax ID Now testing, which can give you a result in 15 minutes. So we have the ability to be able to open, again, in a controlled manner in many places to tourism with a smart strategy of testing people when they come in so that you know whether or not they've been exposed or not. That is a feasible strategy, especially for an island like Guam, where you know who's coming in. You can either make sure they get tested before they get on the plane, ideally, or on this side before you release them from the airport with results back in 15 minutes. That is possible. That said, you can't even think about that until you get the virus under control. And with 12% positivity rates, that's not even an option that's on the table. And I'm just saying that very honestly to you, because I want you to understand what can happen if we all do our part and get this virus under control. Practice my 3 W's. Wear a mask, wash your hands, watch your distance, even around people who you know, even around your relatives for 2 to 4 weeks. If you do that, then that puts your officials in a position where they can start thinking about how can we reopen the tourism again? How can we reopen our society again? And it can happen, but we've all got to do our part. We've all got to work together collectively. And to the business leaders on the phone, I want you to hear me say that again, reject that false dichotomy, reject that false comparison of you're either for reopening or you're for health. Every business on the island of Guam should be going around and saying to their employees and to anyone who will listen, we need you to do your part because that's what allows us to reopen and get back to business again.
Thank you, Dr. Adams. Next question. What is a realistic timeline of getting back to life without masks and all the requirements of COVID? Will we eventually have herd immunity, or is a vaccine the only long-term solution?
So let me go backwards. There's a couple of ways to get to herd immunity. One way is by letting everyone get the virus. Now, that said, that's going to cause hospitals to be overwhelmed and people to die. And there is no virus in the history of mankind that we can point to where we intentionally pursued herd immunity as a strategy just by letting people get the virus and die. There just really isn't. The way we get to herd immunity scientifically is through a vaccine. We get people vaccinated and enough of them get vaccinated that they become immune to the virus. And we expect that we will have a vaccine by the end of 2020. And I talked to Tony Fauci, I talked to FDA Commissioner Steve Hahn, I talked to all the companies, and we now have 5 candidates in phase 3 trials, which is nothing short of miraculous. The fastest that's ever been done before was for the mumps vaccine, and it took 5 years. But Operation Warp Speed, without cutting any safety corners whatsoever, has been able to pull together scientists, has been able to really enroll large numbers of people in trials, which is another way you speed up your results just by having a lot more people to look at. And it's done things in parallel versus in series. So I want to give you a real example because I want you to understand that this process is safe. I was in Texas. There was a facility that's 200,000 square feet, $150 million facility that can produce 20 million doses of vaccine in a batch. 20 million. That's more than enough to take care of Guam. It's already been built and it's waiting for a vaccine to be authorized. Normally, you wouldn't even start to build that facility until the vaccine had been approved, and it would take a year or more to build it. That's how we're accelerating this timeline without cutting any safety corners. We're just spending a whole lot of taxpayer dollars so that we can get this vaccine to people as quickly as possible. And I expect that on an island like Guam, you all are very different. You're very unique because I can't go to Texas and say, hey, we can get herd immunity by early spring next year in your entire state. I just can't because the state's too big. Guam, 150,000 people, we could get herd immunity in Guam by February or March. We really could if we get a vaccine that's safe and effective over the finish line, we get those doses ramped up, and you get enough people on the island to actually take that vaccine. You could truly get back to a sense of normal a lot quicker than anyone else simply because you're a smaller island with smaller numbers of people, and that allows you to more quickly get to herd immunity. So I think it's possible by late winter, early spring. I think that we have to remember that the science and the data are going to lead the way, and that vaccine hesitancy still could rear its ugly head and prevent us from getting to herd immunity. But again, I want to remind you that we can get back to normal like many of the Asian countries have, even before we get a vaccine. They're open right now. They have less than 1% positivity rates in many places without a vaccine. And it happened because they all practice these public health measures. So do what we can right now. Get your flu shot, wear a mask, wash your hands, and watch your distance. We can drive down transmission in a matter of weeks. We'll get to a vaccine, and then we can put this thing away for good.
Thank you, Dr. Adams. Last question, I promise. People have been violating public health guidance repeatedly. Are you aware of how different states are enforcing these mandates, and if they have been any successes? If there have been any successes, if it comes down to individual rights and freedoms versus the right to live, how do we address that concern?
Well, that is a tough nut to crack. And one of the things I want to tell you is people talk about these masks and they talk about mandates all the time. I want to remind you that it took us 50 years in this country to get to a point where we could get people to say, hey, everyone needs to put on a seatbelt or we're going to give you a ticket. It took us 50 years in this country to eliminate smoking from many public places. Culture change takes time. And I say that to you because I want you to understand we have to have love and compassion for our neighbors, even when they aren't doing some of the things that we know they should be doing. But that said, we need to help them understand that your actions may hurt your grandmother or your grandfather or your uncle or your auntie. They may overwhelm the healthcare system. And when you have a car accident or your grandmother has a heart attack, there may not be a bed available because it will be filled with a COVID bed because you helped spread the virus. That your businesses will not be able to open and you won't have a job and be able to pay your bills because of COVID spread. We really have to understand we are all in this together, and there are simple measures that we all can take. And we want, and that's why I'm here speaking with you all today. And I think your governor has done a really good job of trying to explain to people why this is important. And I think that she's been forced into some tough choices because people won't cooperate. But again, think back to the challenges that you all have had with typhoons and weather-related phenomenon. Think back to your resiliency after World War II. You have been through worse, Guam. You really have. And you can get through this again if you just pull together and follow these basic public health measures. Even though you're fatigued, know that we are almost to the finish line and we just need to hang on a little bit longer. You did it before and you can do it again. And I think if we appeal to people in that way and give them the information and help them understand the timelines, help them understand we're close to a vaccine, help them understand that we can reopen, and we're not here trying to tell people to shut down. We're trying to tell them the way we open is by lowering disease transmission. And we have a plan to do that if everyone cooperates. I think that's the way you appeal to people. And again, I completely support your governor if she feels that she needs to shut some places down that have been proven by the public health officials to be major sources of spread. But understand you're forcing her hand by not following these public health measures, and you make it easier for her to open and to give people the freedom and the flexibility to do the things that they want if we get this virus under control. Because your governor, your health commissioner, Dr. Felix, they just want to save lives. That's what they want to do. They want to keep you safe. That's what they want to do. They want you to go back to work. They want to open again for tourism. And they just need your cooperation to help us get there. So I'm sorry for getting a little bit emotional, a little bit passionate about this, but I just have so much faith and confidence that you all will get through this. And I wish I lived in a place where we had 150,000 people and we had an island where we could understand who's coming in and who's going out, and where everybody knows everybody and really cares about everybody deeply, so that we could quickly get this virus under control. You can do this in a very short amount of time. You just have to have what I call the fourth W, the will to make it happen.
Thank you so much, Dr. Adams. Thank you so much for being so gracious with your time to take our questions from our local media. I also failed to recognize Bob Fenton, Regional Administrator for FEMA Region 9 with us. Thank you so much for joining us. I'd now like to turn to Dr. Mike Cruz, who leads our surgeon cell. He has been instrumental in our local response. I'd also like to acknowledge Dr. Felix Cabrera, also instrumental in our local response. But Dr. Mike Cruz, would you like to make some closing remarks before we close it out with Lieutenant Governor?
Sure. Admiral Adams, thank you so much for this conversation. You mentioned this harmony. We have a saying here on Guam, it's inat fat maulik. Inat fat maulik literally translates to make good. And it's about us as a people coming together to bring order and harmony back to our island and stuff. So that's kind of an interesting dilemma, because this harmony means coming together as a people. That's what we do. We see each other every day. And so we're gonna have to figure out how to best do that so that our island can get back to exactly what you're saying. Inat fat maulik. So just maasi for taking the time with us today.
Thank you, Dr. Cruz, and thank you, Dr. Cabrera. Now I'd like to turn it over to Lieutenant Governor Joshua Tenorio for his closing remarks.
Thank you, Crystal. And you know what? Quite frankly, I think maybe it might be more appropriate to pass it on to the governor first, so she's able to thank the Surgeon General directly for his encouragement and his support and confidence of all the efforts that she's led.
I want to thank the Lieutenant Governor for getting the haircut to match me so that I feel good tonight. That's my brother from another mother there.
Thank you very much, Surgeon General Adams, for those inspiring words. And you certainly do know about our island and what we have gone through in our struggles and in our conflicts and in the hard decisions that you have mentioned that we needed to do. This is exactly, I think, where we are today. Looking at how can we get back to some normalcy so we can enjoy our family during Thanksgiving and during Christmas. And we're going to be giving a call to action to all the community. Let's all work together. Here are the metrics. We're going to get to these metrics, but we can only get to these metrics if, like you said, we did the 3 W's and your fourth one, which is the willpower. So I appreciate your recognition of all the work that we have done to contain this virus. And you're right, we were almost there. We were almost there, and things broke loose and under control. And I especially like your comments about it's our responsibility, our comments about loving your neighbors, your comments about the social determinants is just right on point. And we are going to use all of that to help us get through this. Thank you for your time, and thank you for those inspiring words, and also for your advices in the many medical other jobs that you do with the medical chronic diseases. Thank you.
Well, thank you. And you all are also very lucky to have a governor who is a nurse. And that's just amazing that you have that there in Guam. So many assets that you have that I just want you all to recognize and to take advantage of. And we mentioned the holidays. One of my best friends, my roommate from college, is from Guam. And I know Christmas is very important to you all. I know it's incredibly important. I want you to know that we absolutely can get this thing under control by Christmas on the island if everyone does their part. Thanksgiving's going to be a tall order. It's possible. It's possible when you look at the way the virus is transmitting, but you have to take measures now. This virus is tricky. This virus is terrible. This virus is unforgiving, and we have to have an incredibly high level of compliance with these public health measures, which is why your governor has been so strict recently. If you want to be able to have a normal or somewhat of a normal Thanksgiving, it is possible when you look at the fact that the virus takes 2 to 3 weeks to work its way through a population if it's not being spread to other people. That's how long it takes to run its course. So Thanksgiving is a possibility. I just want to be honest with you. We may still have to have some limited Thanksgiving gatherings, but if we want to have Christmas, and I know how important Christmas is to you, it is possible. It can happen. We just got to work hard. So good luck to you, Governor, and thank you so much for your hard work, for your dedication, and for your clear commitment, passion, and love for your people.
Dr. Surgeon General, I just want to thank you too for the time and for pointing out that the people of Guam really have in their history overcome so many adversities. As you pointed out, just last year, we celebrated the 75th liberation of the island. Everybody had a role in rebuilding the island. And as you pointed out, everybody has a role in fighting the virus. The level of transmission has been very high in home settings. And although that is a strength that we come together as family, you pointed out, including in your own personal experience with your family, how that can undermine our effort to beat the virus. And so even in the setting, and I'll tell you my own example, yesterday I went to see my mom for 10 minutes. I had my mask on. I stayed away from her. I went to make sure she had everything she needed, then I left. Unfortunately, that's the new normal that we have to live on until we can beat this. But underscoring this is going to be everybody recognizing that they each have a role in fighting the virus. Last thing I wanted to point out, I'm one of the two. I think the governor's one. I'm two. I'm the one with the high blood pressure. So I'm the one that needs to monitor it. And I've been getting in the habit of taking my blood pressure, partially as a requirement of my doctor, but really to understand what's going on with me. And so I would tell you that Guam has a high prevalence of high blood pressure. We have heart disease and diabetes, all of the things that in the public health context we have to battle. And this is why the center of the response for COVID and for all of those chronic diseases has to be at public health, and it should be heavily weighed on the prevention side so we can reduce the flow into the hospitals. And finally, I just wanted to give a shout out and recognize my good friend Bob Fenton from FEMA in Region 9 and Eric Hiding over at Region 9 at U.S. Department of Health and Human Services. And I just want to tell you, Surgeon General, that the two of them have been on calls sometimes daily with our team. They've been able to help us source all of the support we need at the hospital and at public health to really go forward and try and win this fight. And I do believe that we're turning a corner. And I really want to thank you for your time and attention and for all the attention to the federal partners. We really, truly appreciate it. Thank you.
Thank you. And I just want to say that from the mainland, we talk about Guam all the time. We recognize how much you all have done to support the rest of the country, and especially to support our military. And we're going to make sure you get what you need. But I also want to be real. You ain't close to us, so we can't just throw something on in a box and get it to you overnight. So we need everyone to do their part, because if you overwhelm your healthcare system capacity, it's going to take us upwards of a week to get you help. And that's what really scares me right now, is just the distance makes it difficult for us to provide immediate help. So we need the people to do the right thing and give us a little bit of a buffer while we work through some of the challenges that exist. And I'm so glad you mentioned household gatherings. I want to be explicit like you did, that when we look at the spread that's going on across the United States right now, the dynamics of disease spread have changed. Earlier in the pandemic, a lot of disease spread was happening in public places and public gatherings. And we shut down a lot of these public gatherings, and people also started to do the right thing and avoid these public places. Now, when you talk to doctors and when you talk to health departments who are doing contact tracing, they will tell you that the majority of the spread is occurring in the household. It's occurring from son to mother. It's occurring from uncle to nephew. It's occurring in these close contacts, because you can't look at someone and tell whether or not they have the virus. So we have to remain vigilant. We have to minimize unnecessary encounters, especially for the next several weeks. And when we do go to visit someone, as the Lieutenant Governor said, wear a mask and keep your distance from them, because you could have the virus and not know it and be spreading it to them. And when you are at work, for the people who are working, that's the other place where we're finding a lot of spread, is in the break rooms. We know that you all know and love each other. And the people who you work with, they're your family too. And so you get into the break room and you start eating lunch, or you have a coffee break, and you go, oh, that's my buddy Felix. I know him. He doesn't have coronavirus. I'm around him all the time. And you take your mask off and you get in and you relax. And then all of a sudden, that's all the opportunity the virus needs. So understand these close household contacts among friends, among family members, are where we're seeing a lot of the spread right now, as the Lieutenant Governor said. And that's where we have to remain especially vigilant, so that we can, again, hopefully get to a normal Thanksgiving, but definitely shooting for getting to somewhat of a normal Christmas.
Thank you, Surgeon General, and thank you to your team for being so gracious with your time. This was very timely remarks, re-energizing our community. And so it was great to hear from you. Again, thank you for taking our media questions. And I want to close it out by telling everyone to stay safe, to follow the 4 W's, as the Surgeon General said. And what is that again? To wear your mask, watch your distance, wash your hands, and have the will to can you complete
exactly. Have the will to do it. And I just want to also say thank you to the federal team, to Bob Fenton, to the captain, to the commander, to Ed, and to everyone else who's really rallied around supporting Guam. And thank you to you, Crystal, for moderating a wonderful discussion. I hope it is helpful. We can do this. We can. You can do this. So again, let's have that will to get it done.
Thank you again, and to our viewing audience online, thank you for joining us. This will conclude our conversation with U.S. Surgeon General, Dr. Jerome Adams.